Hello, my name is Vincent Leray, and I'm an assistant professor of medicine and epidemiology in the Division of Infectious Diseases in the Department of Medicine and the Department of Biostatistics and Epidemiology at the Perelman School of Medicine at the University of Pennsylvania. Our paper is titled Disparities in Absolute Denial of Modern Hepatitis C Treatment by Insurance Type. And the premise for this study was that given the high costs for the new direct-acting antivirals for chronic hepatitis C treatment, many insurers have enacted restrictions for the use of these drugs. Restrictions such as advanced liver fibrosis or cirrhosis, prescription by a specialist, or in some cases a period of abstinence to drugs or alcohol. And these restrictions have been particularly highlighted recently in the U.S. Medicaid programs in the U.S. However, the restrictions in commercial insurers and Medicare really haven't been understood. So to gain more understanding of the downstream effects of these restrictions, we conducted a retrospective cohort study using data from a regional specialty pharmacy called Berman Specialty Pharmacy to calculate the incidence of absolute denial of direct-acting antiviral therapy over the initial 6 months of the modern DAA era, which was November 2014 through April 2015, evaluated the time to prescription and factors independently associated with absolute denial. We chose to use a specialty pharmacy because given the cost and the special handling required for these direct-acting antivirals, they're typically dispensed by specialty pharmacies. So we thought a regional specialty pharmacy, Berman's, which services 4 states, New Jersey, Pennsylvania, Delaware, and Maryland, would represent an ideal data source. Our main study outcome was absolute denial of DAA therapy, which was defined as absolute denial or no dispensing of the direct-acting antiviral after review by the insurer, even after an appeal. And our analyses calculated the absolute incidence of absolute denial to the direct-acting antiviral, as well as conducted a logistic regression analysis to identify factors independently associated with absolute denial over the 6-month period. What we found was actually quite interesting. Over the initial 6 months of the direct-acting antiviral era, those first 6 months, we found that overall 16% of the DAA prescriptions were denied. But interestingly, when we stratified our analysis by insurance type, 46% of patients who were covered by Medicaid were absolutely denied their DAA treatment, compared to 5% of those covered by U.S. Medicare and 10% by commercial insurance. And in a multivariable analysis, looking at factors associated with denial, U.S. Medicaid coverage and the absence of cirrhosis were factors independently associated with absolute denial. What we also found was that the median time to fill was significantly longer for those covered by Medicaid compared to those covered with Medicare or commercial insurance. So we thought that what we concluded was that this analysis highlighted a particular disparity in access to direct-acting antiviral regimens, which really shows the downstream effects of the restrictions that have been put in place given the costs of these direct-acting antivirals. I think that the clinical implications of these absolute denials, particularly for those with U.S. Medicaid coverage, really remains to be understood. The absolute denials may have downstream effects such as potential to progress liver fibrosis. There is the potential that if hepatitis C treatment is not received, and patients aren't cured, that transmission for hepatitis C may occur. There is the potential for ongoing extrahepatic complications due to the hepatitis C associated inflammation. And then, of course, there's the psychosocial aspects of these denials, such as the concern and distrust of the healthcare system. So I think what these results really would, where we go from here, is that really the government, other stakeholders in industry, academia, really need to get together to consider how to improve access to these direct-acting antiviral regimens in order so that those who would benefit from them the most could receive them.